name's Francie Newfield. I'm a volunteer with the Alzheimer's Association, and I am a member of the program committee, and I'm a facilitator for one of the support groups. And you're very fortunate this afternoon to have a very talented, experienced, and dedicated group of experts in related fields here to answer some questions that you have. We've heard from past workshops that people often have questions that they may not have a chance to ask or aren't addressed in some of the presentations, so we've created this opportunity for you. So we're going to introduce the members in just a moment. I'm just going to explain how we're going to be doing this. We already have some of your questions that are written on cards, and thank you for providing us with something to get started with. We also will be having, you'll have the opportunity to ask questions from your seats. We have roving microphones that will be available. And this workshop goes until 2:45. We're going to stop answering the questions probably at about 2:30, and then allow for any of you who have tips, things that have worked for you in your situation as caregivers or family members or professionals that might address some of the questions that have been asked and addressed by our panel members. So if there's something that you've had a positive experience with and you want to share that with the group, please make a note of that, and then we'll be passing the microphone along towards the end of our session for that. Okay? And I know one of our members has an obligation that is requiring her to leave right at 2:45. So in case we're still going, we just want to know that Jill isn't throwing up her hands and leaving.
I have grandchildren.
Oh, okay, so I'm going to really just introduce you by name to our panel members, and they will give a brief introduction about themselves and what their involvement or area of expertise is, and then we'll get going with some of these questions. So to my immediate left is Dr. Joydip Bhattacharya. He's a local neurologist with Physicians Medical Group, and he's also a member of our association's program committee. And next to him is Jill Ginghofer, and Jill for a long time has been associated with the Alzheimer'S Association chapter here in Santa Cruz. She was our executive director for a number of years and continues to volunteer now as a support group facilitator. And she's done a lot of public speaking on behalf of the Alzheimer's Association. And next is Cyndi Murray. Cyndi is a social worker at Pacific Coast Manor Nursing Home, and she's also a facilitator of one of our support groups, the early stage group. And at the end of the row here is Saundie Isaak, and Saundie is the executive director at Lifespan Care Management, and she also has a lot of hands-on experience working with people with Alzheimer's and other dementias and caregivers. So if you'd like to say something further about yourself, Dr. Bhattacharya?
I've been in the community for about 10 years now. I do practice general neurology, but with the practice of neurology, we have a large number of patients who have Alzheimer's disease. So I would say probably 1/4 of my practice involves caring for patients with Alzheimer's disease. And I'm really happy to be here today to share some of the things that I know and learn also from you guys, because you're also doing it in the front line.
Before I came to the Alzheimer's Association, I'd done quite a lot of counseling work and a little bit of fundraising in the Jobber Club. But after I started with the Alzheimer's Association, I have the greatest admiration for caregivers, whether it's family caregivers or professional caregivers. This isn't an easy issue to deal with, but it also has tremendous rewards, and I find that the way that people cope with this disease is amazing and very gratifying to work with.
Like it was mentioned, Francie said that I work at Pacific Coast Manor in the long-term care unit as a social worker. I also help facilitate the support group for people in the early stages of dementia, and I facilitate the Caregiver Group. And there's a few of our members here today I'm really glad to see. But probably the thing that's given me the greatest experience and impacted my life the most was caring for my father. My sister and I took care of our dad over 20 years ago now, and we were his primary support system, and it was a very long journey. but probably the most meaningful thing I've ever done in my life, and I wouldn't change a thing, except if I could take away the disease, which I'm very hopeful that someday I can say it no longer exists.
Hello, I'm also very happy to be here. My background is, before being at Lifespan, I've managed retirement communities with memory care, and I also am just really want to be able to learn today from all of you. Of course, we'll take questions from the audience, but I love to hear new approaches and tips that caregivers that are working with dementia care clients that are finding success. I wanted to mention, if any of you have not heard of JourneyWorks Publishing, it's a local publishing company in Santa Cruz, and they provide a lot of different educational materials, and one of them that's at the Lifespan table that I'm hoping you can pick up, it's a caring card coupon book. So for those of you that are supporting other caregivers that care for folks in the home and dementia care, it's a really cool way to help them take care of themselves. I'll give you an example. You can give them a coupon for helping with transportation or taking a meal. So if you want to pick those up, those are at the Lifespan table.
Shirley's collecting cards, so if you have a card, you want to just wave your hand, try to catch Shirley's attention here. Okay, well, I'm going to start with what looks like a medical question.
Okay.
And this question says that a diagnosis just changed from Alzheimer's to frontotemporal dementia. It doesn't change anything, but what is it? What does it matter, and how is it different?
That's a good question. So, I'm just going to take a step back to try to explain the spectrum so that we can place these in the right perspective. So basically we know dementia where people are losing the cognitive abilities, memory power in one or more aspects. So that's the broad spectrum where this condition exists. So within that there are several different entities. So about somewhere between 50 to almost up to 80% actually is Alzheimer's disease. And then there are several different entities. One is vascular dementia, one is frontotemporal dementia, which used to be called as Pick's disease in the past. And then there is Lewy body dementia. And then there is a whole series of very rare, much more rare conditions. Frontotemporal dementia probably is somewhere between 5 to 10% of the whole broad spectrum. This is different than frontotemporal dementia is different than Alzheimer's disease in the aspect, the part of the brain eventually that gets affected. So medically, pathological terms speaking, in Alzheimer's disease, it's the parietal lobe, which is here, and temporal lobe, parietal is sort of here and temporal is here. Those are the areas that gets affected most. Whereas in frontotemporal dementia, it's the temporal and the frontal lobe that gets affected. A lot of these diseases will start sort of in the temporal area and then they will spread differently. That's one distinction between that. The other distinction is the process, the actual pathological process that causes it is different in in these two different conditions. Frontotemporal dementia, unfortunately, is much harder to treat because there is really no approved medication in terms of that are directly geared toward this versus Alzheimer's disease where we have several different agents. And also the manifestation, the behavior, frontotemporal part sometimes will have more behavioral dysfunction rather than the Alzheimer's disease. For example, hallucinations, improper behavior, we might see those much more in frontotemporal dementia because the frontal part of the brain is affected. So briefly speaking, this is a distinctly separate condition within the broad spectrum of dementia.
Can you tell me where the amygdala is in the whole brain?
Sure. Amygdala is part of the temporal lobe. Yes, it's in the temporal lobe area, and that's temporal lobe is just next to your temple. It's just coincide, both sides. Both sides. You know, if you look at the human brain, right in the midline, both sides is sort of a mirror image of each other structurally, although there are some differences in the functions that they carry out. Okay, so.
If you don't mind, because you're in that category, my brother-in-law is dying from PCA.
Can you tell me?
Posterior cortical atrophy.
I see.
Can you just differentiate that from the other dimensions?
Sure. Posterior cortical atrophy. That's another more on the rarer side of the subclasses of dementia. So it's one of those where the posterior part of the brain, where people have the occipital lobe, and that's more involved with the visual function. So those are the patients that will have more manifest in terms of visual complaints, other than the cognitive aspects. They'll have that, but that's pretty rare, I would say.
Thank you.
Thank you.
We'll have some more medical questions later, but this is a good question. Oh, I'm sorry.
Did we have a follow-up?
I had a medical question. Have there been any studies that show any relationship between diet and lifestyle and Alzheimer's? Like, for example, the countries with the highest breast and prostate cancer are the countries that have the highest meat and dairy consumption, and the countries with the lowest breast and prostate cancer have the lowest have the lowest meat and dairy consumption. Is there any similar corresponding relationship in terms of healthy diet and Alzheimer's, preventing Alzheimer's?
Not in exactly that way, but there has been multiple studies that shows, well, if we look back, what are the risk factors for Alzheimer's disease? Some of them are things such as high blood pressure, cholesterol, diabetes, alcoholism, obesity, lack of exercise, those kind of things. These are all interrelated. Most of these illnesses of so-called illnesses of lifestyle, there are also risk factors for things such neurodegenerative conditions such as Alzheimer's disease. So obviously they are connected. One interesting bit of information is that there has been no new medication that has come out that are focused to treating Alzheimer's disease since 2003. Multiple things has been looked at, medication, supplements, as well as lifestyle issues. The only thing that really pans out that has a positive effect is regular exercise. Nothing else pans out in a consistent basis to have a long-term effect. All the supplements that we suggest from time to time, for example, vitamin B12, vitamin E, ginkgo biloba, some studies show some improvement, some studies don't. But the consistency is usually with the exercise. So that goes with the healthy lifestyle.
Excuse me, I think we're going to move on to some other questions and we'll come back to some medical issues, okay? Thank you. This question, Jill or Cyndi may want to address this, or both. We are moving 1,000 miles away to be near family. How can I help my husband adjust? He is in his 11th year since diagnosis and so far very easy to care for.
I think I've spoken to the person who asked this question, but it is a good question. It's very hard sometimes getting someone to adjust to a new place. And I think family members have to be very careful about the familiarity that the person with Alzheimer's has with the environment, so that they're not going to get lost. Are they a wanderer, whoever asked this question? Do you know? No, we don't know. Anyway, I think you have to be very careful for... Did somebody have their hand up? Have they wandered?
No.
No. Okay. But I think you will have to be very careful, because this is a time when they might be vulnerable to wander. And so for the first 2, even as long as 2 or 3 months, I think you might have to monitor their daily habits until they get into a routine. And then they'll forget they ever came from anywhere else. Although they will probably say to you every day, I want to go home. But you never know where the home is. Usually home is something, I don't know, buried deep in the brain, a childhood home, a dream home. But it's, they will be doing that. And that will be hard for you to take, but they will adjust. They really will. What do you think, Cyndi?
Yeah, adjustment is a huge issue for people with memory loss because every moment is new. They forgot what happened 10 minutes ago, and they're dealing with the new scene right in front of them every time they look around. And so I think just being sensitive to that, to realizing that it's newness every few minutes. They're reminded this is not familiar, this is not familiar. And sometimes we want to convince people you're safe or you're here, this is where you're supposed to be, and it still can't be enough because there's this internal thing telling a person this is not right. And I think just understanding that discomfort level and providing the reassurance and having as much familiarity or routine, keeping things consistent, and then also making sure there isn't too much stimulation going on. I think we live in such a fast-paced world. It's very overwhelming for the brain with dementia to be processing so much and to already have a significant change in environment, and plus any other stimulation you have going on really can cause a lot of distress. So I really see a benefit to minimizing outside distractions or other new environmental things, even whether it's smell or, there can, on all levels, the senses just need to be calmed and centered and reduce as much stimulation as possible when there's transition.
And to add to that, one approach that I've seen success in is recreating, if it's an apartment situation, it can be, going from apartment A to B across the street or across the country, recreating exactly the same room with the same pictures and familiarity, and that can hopefully minimize some of the agitation and confusion.
That's a great suggestion. I'm going to read one more from a card, and then we'll go take some more from the audience, and then we'll go back to some of these, okay? Explain, please, what is a conservatorship, and is it needed? You want to take that one?
Wow, that's a big question. The need for a conservatorship, I think basically when you're concerned about a loved one or a client that is exhibiting behaviors that are unsafe to themselves or others, and their decisions are creating unsafe situations, and it can be physically unsafe, it can be financially unsafe, or legally, then a conservatorship may be needed. Is that the question?
Yeah, what about for placement issues?
Oh, excuse me, missed that part of it. For placement issues, folks that take conservatorships, or?
Well, I know the question that I've heard often is, it's time for someone whose dementia is advancing to move into some kind of a care setting, and that individual may not be desirous of making such a move.
I actually have a family that's right in the midst of that, and it's so challenging. Even with conserving a loved one, having a client that is conserved, forcing them to move is difficult. But sometimes it's needed, and
It's in here.
I'm sorry?
It's in here, page 6.
Sorry, I can't see that.
It's the legal plans flyer that was included in it.
Yeah,
Can you repeat the question?
there's a resource from the Alzheimer'S Association that this, I'm forgetting your name. I remember your dog's name, Sam. Do I get points for that? Does anyone have any comments about conservatorship and placement? It's a really tough issue. I mean, I don't mean to curtail.
This is not to do with conservatorship. Conservatorship is pretty extreme to do with a patient, and you really, really do have to prove that that person is totally incompetent, and that can be quite a grueling process for both the family member and for the person with dementia. But there are ways to get to enable somebody to make the transition into some kind of residential care. And most of them are through, this is very hard to say delicately, but through obfuscation of a certain kind. One of my caregivers' favorite stories of getting somebody into assisted living or residential care is to say the building you're living in has to be fumigated. Now, I know that's terribly, it's very hard for people not to tell exactly the truth, and so this is just a temporary move. And there are other ideas that people have for doing this. And then once they're in the place, and hopefully if they get used to it, you just do not return them to wherever it was they were living, where it was unsafe for them. And I know that a lot of family members have suggestions about how to go through this without having to take a conservatorship. And if anybody has any suggestions, that would be great.
Okay, and we'll take such suggestions a little later. So Jennifer, I wonder if you could take the mobile mic, and Shirley will have one on this side, and we'll take 3 or 4 questions if anybody wants to raise their hand and ask a question. Okay, I see somebody back there with an orange or red shirt on.
Hi, I'm wondering what local resources there are for day care for somebody who's in an in-between stage of needing more surveillance but not a complete living change situation. And is there something that's appropriate for early, middle, late stage Alzheimer's?
If it's for daycare, is that what you mean, for the person?
Yes.
Yes, for daycare. Well, we have 2 organizations in Santa Cruz. One's called Elder Day, which is a health center. It means they have nursing on staff, and they pick people up from the home and they deliver them back. They usually pick them up about 10:30 in the morning and deliver them back about 3 in the afternoon. And they have programs for people. They play music, they have activities, they have food. And because they have a nurse on staff, their medications can be monitored. And so it's a wonderful program. Quite often it's a challenge for family members to get their paid person to do this. But once they've got used to it, they often just love it. And one of the ways you can get them there, I keep saying these ways you can obfuscate, but one of the ways you can get them there is to say Elder Day needs volunteers, they need helpers. And that's a great way to make them think, oh, I'm going to be useful. And the other program is Cyndi Celebrations, which is a sort of more social daycare program. Again, they pick the people up at home and they deliver them back home. It's a very safe environment. And they have activities. They even play Trivial Pursuit, which amazed me. Some of them knew more than I did. But and they have a wonderful meal, and they have a great time. Some of them think that's their birthday party, and they think they have a birthday every day. And getting them used to it, you often might have to go with the person for a few times and until they get used to it. Anything to add to
I think there's a real fine line of when a person's ready to engage in that type of environment, and unfortunately, we don't have something that I know of in Santa Cruz that really meets a person's social needs towards the earlier stages, and where they may not be safe at home, and they're not ready to be in an environment that they can tell is geared towards taking care of them. It's a huge need.
Wondering if there's any focus on liaisoning with the senior centers that are in the community, because as far as I know, none of them have any kind of aspects. They're usually related to more independent seniors, and my experience is they're kind of fearful of Alzheimer's, and they, are kind of not so, at least connected to creating some dynamics in their own senior organizations that could be assistive of people in early stage memory deficit. So I'm wondering if there's anybody who's working with the like the one on Bay Avenue, and that could be a couple hour experience that a family member could bring, that could be semi-observable with other seniors, where they could be actually doing things and creating things, as well as getting assistance by other people who could be trained to do that.
You know, actually, we have an audience member who's involved with the senior centers at Carroll.
Hi, my name's Carol. I'm actually with the Highland Senior Center in Ben Lomond, and I'm also with Meals on Wheels. And we have dining centers throughout the county, and at our centers, we do have people with dementia. It does have to be early stage because we have one staff person per site. Though we have a number of people in Ben Lomond that have dementia. Their family members bring them in, or we contract with Liftline, and Liftline brings them in. It gives them a chance to socialize with others. It is only a couple of hours during the day, but it is for people with early stage Alzheimer's. They come in, they do get to still play cards, they do come to the exercise classes, they participate in our birthday parties. And it's just a nice way for them to stay connected with others, and it's also a nice, even though it's a brief amount of time, it's a good way for their family members to have a couple of hours respite where they can run errands, or I encourage people that are caregivers to just go sit somewhere and rest. And I know that's hard to do, but I'm a former caregiver, so I know it feels good. But so a lot of the centers, we do accommodate people with dementia, but the part that makes it difficult for us is if they wander. Because like I said earlier, we don't have the staff. But, you know, if someone has a buddy that's at, Mid-County, which is on Bay Avenue, see if that person is willing to keep an eye on them while they're there. It is a nice way to keep people connected in their community.
Well, first of all, thank you all for being here. It's really a pleasure to have so many different faces from the community that I'm already beginning to recognize as I'm new to this calling. I think many of us are called to relate to Alzheimer's and dementia victims. I am one of those people. I'm a volunteer primarily, currently at a rest home, and I'm deeply involved with one particular person who was my high school teacher 40 years ago. So my question is this, exercise, I see this in terms of offsetting so much of what is problematic for now other people that I'm becoming close to through my association with my dear friend. Is it only physical exercise? Because what I'm engaging in as a volunteer, aside from wandering around the facility with them on whatever errand may need to be run, is a sense of communication. And it's almost a temporal, a mental exercise that I have been persuaded is almost because the mind breaks down, this type of exercise isn't practical. And I am finding the opposite. The more I engage, the more we talk, the more we play games, the more I respond to whatever they want to talk about, and I'll role play. I'll be whoever they want me to be in a very serious manner. I will see an improvement on a regular basis. So, Doctor in the white shirt, I think this is real. Thanks again.
So, I think that's a great point you made there. One of the risk factors for developing Alzheimer's disease is the level of education one has achieved. The meaning of that is that the more you study it, be that a degree or be that you did it on your own, you developed more neural networks in your brain. And that is the process which is encouraged by all these activities that we do, whether it's a physical exercise or a mental exercise. When you are doing puzzles, you are reading a book, you are doing crossword puzzles or whatnot, what you're doing is that what one is doing is that they're exercising different aspects of their brain, because all these activities are not done in the brain as one single unit. There are different places where different faculties reside, and then there is this connection between them which integrates them together. So more you do role-playing, music, puzzles, reading books, the simple act of reading a book actually recreates in your mind all that is happening. So you have to involve the part of the mind, that part of the brain that works as a visual field, because you're creating that in your mind. Also, you have to have memories such as, so when you create a place like this in your mind, you can smell, in your mind you can smell the trees. And that you're harking back to certain parts of your brain, which has the olfactory memory. So all these parts get used. So absolutely right. Exercise wonderfully stimulates blood flow to all parts of our body, including our brain and other parts. Mental exercise stimulates the neural network, which we can always create. And so more you do, the better off you are.
There's a question here on a card that I think comes up a lot, and Saundie, maybe we'll start with you and see if anyone else wants to address this. It seems like it's time to hire a caregiver to provide some assistance and provide some companionship for my mom. How can we get her to accept this type of help, which she seems not interested in?
Let me guess, she says, I'm fine. I don't need any help. We do get that question a lot. And whether you're a family caregiver or an agency offering caregiving, resistance is common. And I would really recommend evaluating, taking a step back and really evaluating what it is your concerns are from a loved one's perspective. What are you seeing that you're concerned about? An example might be that you notice that you come home and your mom has left the stove on, and she's not done that before. That's a safety concern. So evaluating what her needs are, and then being able to sit down and talk with her about what you see is happening, and let her talk as well. And sharing with her, you're not going to be able to come every day at the end of work as a daughter and check on her to make sure the stove's been turned off. So talking and having a fluid conversation, introducing a caregiver, whether it's yourself as a family caregiver or a paid caregiver, I like to reframe that phrase. Rather than using caregiver, maybe a word that your mom would be more comfortable with would be you need an assistant. Or maybe a driver to go to the store and do some shopping. The word caregiver may put her on the defensive, and she may say, I don't need that. So reframing the level of offering that assistance. Let's see. I think I already mentioned this, but I'm going to say it again in case I didn't. Ask why they're concerned about not having help. Let them do the talking and really try and understand where they're coming from. They may have some misconceptions. They may think, your mom may think, that you're going to hire someone to be with them all day. When really you're thinking maybe just someone to come in the morning and having that open conversation with them.
Anybody else want to address that?
Yeah, Dale Phoebes, who's the executive director or the director at the Alzheimer'S Association in Santa Cruz, had a great suggestion yesterday about introducing someone to work with your person who has Alzheimer's. And that is to, rather than say I'm going to bring someone into the home, go to a restaurant and have that person come in and introduce them as if they were just a friend you bumped into. And then after that, this is, again, is a little obfuscation. You can say, oh, that friend really would like to take you for a drive tomorrow. Are you interested? Just some way of doing it so that the person with the disease doesn't get defensive. Because in a way, when you say you need somebody to be with you, you're saying you're no longer competent, and it's hard to take that. So there are ways that you can introduce someone. And the earlier in the disease, the development of the disease, the better in a way, to have them used to other people being around.
That's exactly what I wanted to say, was that if the family is close, the sooner the family gets involved with the care, recognizing what's going on, the better the outcome is in terms of the future management. And part of that is that sooner you recognize, maybe you can start introducing some of these ideas about helpers from time to time, or being friends with somebody. And I think that eases the process a lot in the long run.
I don't want to beat a dead horse here, but one other thought. When my father was in the very early stages, he was a young man. He was an airline pilot. He was an athlete. He was a kind, gentle soul. And so to tell this strong man, I'm going to bring somebody in to help you, was not going to work with him. And that just felt so disrespectful coming from, a college student and looking at my father. So we had to figure out a way to bring somebody in when it wasn't safe for him to be alone anymore. And I just simply told my dad, I said, I'm just going to ask this person to come over and provide some help to me, and she'll be here in case you need her. So it was a very indirect way of saying, she's going to be here, she's going to be doing some things, and hey, if you need something, you can ask her. But it was not directed towards him or somebody to take care of him, and that put him at ease, and it worked out very well.
My father-in-law has moved in with us after the death of his wife about 2.5 months ago. And so he has, I guess, the early stages of Alzheimer's. And so I'm here to learn. I'm on a learning curve, and I'm on the front side. And I'm with him throughout the day, and I'm his primary caregiver. And so I'm like a sponge, so I go to these kind of things, and every question and every answer that's given, actually, in my mind, I have more questions. I picture it, and I can relate to it, but then it brings up more questions. So rather than learn from experience, I don't want to learn from experience. I want to learn from all of your experience. Could you name really good resources, really good books, I'm a reader, crash courses, things that would sensitize me and help me attune more quickly to this learning curve so that he gets the best that he can get. And I listen to some of the stories of the hard things, and I know I face them, but I want to make it as smooth as possible, and I know part of that is going to come from the wisdom of others. And so do you have books that you would recommend, or resources?
I'll let other people address books. There are many books. There's a very famous one called The 36-Hour Day. No one on earth has ever finished the 36-hour day, but it is
Including myself.
exactly. But it is a very helpful book. We had another book at the Alzheimer's Association called Alzheimer'S: A Caregiver's Guide, and it's by someone with the last name of Greutzdfeld. I think that's just off the top of my head. That was very helpful, and more helpful because it was all in paragraphs with bullets, so you could look up specific issues you wanted to address. But the reason I was greedy and jumped in to answer this question, because my observation is that going to an Alzheimer's caregivers group is one of the most helpful ways to get educated. You'll hear from all these different caregivers, and you'll understand that everyone who has the disease of dementia develops in different ways and is a different individual, but you will hear so many different ways of coping with all of those things, so that when those markers come up for you in the development of your care for your patient or person with Alzheimer's, you will have resources already in your knowledge bank to deal with those. I think that other caregivers are the greatest learning curve you could reach out for.
So for people who have a new diagnosis or are obviously in the early stages of dementia, please call the Alzheimer's Association. Dale is available to help people figure out whether it's a good fit for them and their loved one, the person who has been diagnosed, to join a support group. We meet on a weekly basis, 8-week sessions, and we have 2 groups that meet simultaneously, one for the care partner and one for the person who has memory loss. And these groups have been just an amazing place for new friendships to begin, and the doors are just wide open. It's a place where a person can say, I have memory loss, I am scared to death, I don't know what to do, what's going to happen to me? And it's been an amazing place where people have just found a huge support system, and I've watched our support group just develop into like a little family. They love and care for each other, they share their burdens, they encourage each other. It's not, I can just say I'm involved with the greatest group of people, because they not only receive support, they give, and it's a beautiful thing. So I just encourage anyone that knows of someone in that situation, if they're willing to talk about it, it's a great place. I hate for people to miss that opportunity of the early stages to connect and build that bridge for the future with their loved one, rather than it be, I'm the caregiver, you're the patient, you're over here, I'm over here. There needs to be a bridge. It can be just so much less stressful. There's so much support there.
So your support groups are all at PCN?
No, that's my full-time job. And then I work for the Alzheimer's Association as a facilitator for the early stage group. And that's 1 day a week. It is a group that you have to be, it's not an open group. It's the people involved have to be screened. That's why I'm pointing towards Dale. Call Dale. And she does a screening process to make sure that it is appropriate for people to join. And then when we have openings, periodically through the 8-week sessions, we'll have openings and people can join if it's appropriate.
Can I add just a little bit, or do you want to finish some?
I just wanted to mention some other resources. We have some caregiver training resources here in our county. Del Mar Caregiver Training has classes throughout the year. And you can contact them at Health Project Center. And then there's also a 7 class series through Cabrillo College called the Caregiver Training Series. And that is at a nominal cost. And you can contact Cabrillo Extension to find out about that training.
Yeah, we partner quite a bit with Health Project Center in Del Mar. It also has resources and support groups that aren't reflected on a handout that is actually reflects our support groups, though, that's in your program today, your folder. Sorry, I'm losing my word finding abilities late in the afternoon. But a list of all of our support groups is posted in here. We don't post the early stage specific for individuals living with their care partners, because there is a pre-screening and criteria for that group. But the groups that Jill and Francie both facilitate, and Shirley Sapina, are drop-in and intended more for families in the middle and perhaps later stages of the disease. So the early stage groups certainly, and that's a caregivers only, the drop-in. So those times you're always welcome to come whenever that works for your life and meets your needs. But if you're dealing with earlier stage issues, do feel free to call us. That's the 800 number. It's on the flyer. It'll bring you to our office. And we can talk to you about the specific criteria for the support groups for that.
Just to tie that up, and I just wanted to say that Dale, I think your organization and you are one of the best resources we have in town. And I wanted to just also mention about that module about one that's, I think in Palo Alto area is the next one happening.
Series
Want to
program?
mention about that series?
What is it? Do you want me to say that?
Yes.
I don't have any.
I'm sorry, I'm not meaning to take away from the panel either, just a compliment to those things. But we are starting new programs. We have standardized programs that may help families understand the signs, the early warning signs and things of the disease. We have a beginning of basics and entering in and beginning into Alzheimer's disease, and we have a three-part educational series that's specific to the families the issues that families deal with in the early stages, more related to legal and financial affairs and driving and some role changes within the family dynamic. So they're specific to that. I don't have that date in front of me, but you could call our office and we could give it to you. It's mid-May, so you have plenty of time to do that. And just lastly, I'll say too, with reference to the question about books and resources, thankfully there are so many really rich resources and books out there now, and we have a lot of them in our library, and the library is always out in the hallway of the office, so it's accessible all the time, and you can check it out at any time that you need. So, and we can guide you as to what your particular stage of the disease is and what your needs are as to what book might be best for you.
There's a question on one of the cards here that hasn't come up yet, but in the groups we do often hear it, so I'd like anyone who'd like to address this to respond. What to do when other family members do not reach out, and maybe I'll add to that, and who don't understand or see things the same way with the same level of severity or concern perhaps that the more immediate caregivers do. How can we make people be more involved or understand more about what's going on with our family member?
If you have some thoughts. I would like to just mention that one of our caregiver groups, we have a member here who attending this conference I'm looking at right now, and she and her sister are here together so that they both can be educated and both make the right decisions and family decisions about the care for their mother. And the most successful journey for a family and for the person who has this terrible disease is when the whole family is on the same page. And very, very often that's not the case. I mean, we like to think that families are a family, but families are not always a family. And people argue and disagree, and the person who isn't with the person with dementia every day often says, I spoke to Mum last night on the phone and she was terrific. There's nothing wrong with Mum. And that's because the social skills are probably the last to disappear from the brain. They can all say, hi, how are you? How's the weather by you? It's great here, I'm fine, I'm doing fine. And so they sound okay. And when there is a disagreement within the family, the best thing that I can suggest, and this does involve work for Dale of the Alzheimer's Association, is to try and have a family meeting and hope to get on the same page. And the best thing you can do as a family member is to get educated. And it's hard sometimes when someone's resistant, I know. But having a family meeting is a good way to go about that.
A lot of people in my group have struggled with this as well, and just said, I have so-and-so doesn't call, they don't want to know, they just drop in for a few minutes and they really have no idea what my struggles are. And what they found to be really helpful is to invite the family members in to come over for an extended period of time. Asking specifically, can you come and take Mom to the grocery store? Grocery store is a great place for a loved one to see exactly, how much confusion is going on there and how difficult navigating through a grocery store would be. Those are eye-openers. And of course, you can't force family members to accept what's going on. There's so many different things happening for each person. It's hard to accept the realities sometimes. But those are ways to gently invite people into your life, as well as neighbors, friends, and have them over, have a party, let them in your life so that you're not doing this alone. It's so much better if you can share and get over the stigma and the fears, because you can do this alone, but it's so much harder. And opening that door and asking for support and just inviting people into your life can just be so beneficial.
On that same token, one of the other things we can try, from my role as a physician, might be also to encourage the family members to come to the doctor's visits with the patient And that might be an avenue for the rest of the family members to know more about what's going on and get some more explanations, to encourage the understanding.
I think that's a tribute to Dr. Bhattacharya, because not all doctors are even going to have a family
Okay, I'm going to ask one more question from the card, and then I'm going to kind of take the temperature in the room and see how many people have tips and ideas they want to share, and then decide whether to move in that direction or to take a few more questions from the audience. Okay. This is more of a medical question. How might I pursue titration of toxic long-term psychotropic prescriptions if Medi-Cal and Medicare cover only for 14 minutes every 6 weeks for psychiatric visits? Is there something that a primary care doctor can do, or a neurologist?
That's a difficult question to really help. And I know it's part of the reason is that we have, unfortunately, difficulty reaching the psychiatric care in our county. The primary care physicians and the neurologists, all of us are getting more and more familiar with the medications. But the problem, honestly, is the same 14 minutes. We all have that burden. So I'm not sure if I can be extremely helpful in terms of giving some great ideas. But it has to be really looked at from, case by case. That's the best suggestion I can give.
What is this 15 minutes? I don't get it.
It's a billing unit.
Oh, it's not so much the 15 unit, but there is a limitation on how much time you can spend with one patient, because you still have a schedule for the day.
That's
So,
not only Medi-Cal, that's any care.
right. No, I know. I mean, it's in general. You still have to see a certain number of people in a day. People have appointments.
That was my question, and my concern is I've talked to primary care doctors, I've talked to gerontologists, I've talked to even neurologists, and they say, we can monitor the diabetes, we can monitor the thyroid and the hormones and everything else, but we're not willing to touch the psychotropics. That's a psychiatric issue. Go back to the psychiatrist who prescribes these, but of course the psychiatrist will only say, every 6 weeks. You can't titrate somebody down after decades of sleeping pills and medication for 14 minutes every 6 weeks, because the care providers through IHSS or even the people that you hire, they are not medically knowledgeable to recognize if they have Parkinsonian tremors or if they're falling or if they're sleeping all the time. Really, they can't be responsible for monitoring medical changes of medicine.
Absolutely correct. The way the healthcare has worked in this country is that the mental health part is always carved out, separate from the medical care part. And all those medication and management of them has been always considered separate. So not all medical insurances will cover even the psychiatric care.
Right. And
so that is a systemic problem.
And residential care is not an option because, again, Medicare, Medi-Cal doesn't pay, and you have to have consensual admission, and then, it's...
But one thing I would say about the psychiatric medication also, that you don't really taper them very fast usually, because people are on these things for a long time.
Right.
So when you make the modifications, you do it over time. One does one thing at a time. That's been at least my principle, to do one thing at a time. So I think the first step will be to establish a good rapport with the psychiatrist and establish in the first visit or whatever, what is the goal? What are we going to do? And follow along the pattern. And that might give some guidance or some semblance of discipline in what we are approaching.
But again, if there are side effects, you don't know.
Well, I mean, most of the doctors will call back. He's required to call back. I call back my patients in 24 hours or less.
Okay.
And that is the common expectation. Okay?
Thank you.
So if you have side effects that are intolerable, you call your doctor.
Thank you for tackling that tough question.